This video discusses the likely motives behind COVID-19 related actions of some state governors in the United States. Hello friends, this is Unmasked Truth with Harmanjeet Saini, where I provide unique analysis of world events based on the unmasked truth that after surrender, Germany continued World War II clandestinely and became a killing machine. I also provide true news that you will find nowhere else. Now, what is going on in America is mind-boggling. It defies rationality unless there is an ulterior motive behind it. A huge country like China has been able to curb the COVID-19 pandemic, though it originated there. In contrast, the United States, with the best vaccines in the world available free for the entire population, has the highest number of deaths in the world at about 654,700. Brazil comes next with 579,330, followed by India at 438,400. The real number of deaths in India is closer to or even more than 5 million rather than what the official figure state of 438,400. The situation is turning bad in America once again due to the more virulent Delta variant of the coronavirus. At the current rates, new deaths are projected to reach 100,000 additional deaths by the end of the year, or in about 4 months. Even if we accept the highest number of COVID deaths to be in India, the number of deaths in America is still ridiculously high. What could be the reason? Now let's look at India. There is a very logical explanation why the real number of COVID-related deaths in India is so high, perhaps more than 5 million. I provided the explanation in my video dated May 3, 2021, titled Modi government is committing genocide in India with its response to the COVID-19 pandemic, with a summary provided in the August 5, 2021 video titled Warning to Modi, Shah, Ambani, Adani, Gujaratis and Rajasthanis. We will fight back to prevent you from destroying us. As the title suggests, the real reason is that Modi government is deliberately allowing people to die of COVID-19 in India to please his allies Germany and China. The coronavirus was a bioengineered virus which was meant to be unleashed on the Punjabis and Sikhs of India to kill tens of millions. But the virus inadvertently escaped the Wuhan lab and started the pandemic there. Once scientists in Wuhan caught the disease and started dying of it, the Chinese government panicked. The only model it had for dealing with the disease was the bird flu in China and Hong Kong and the mad cow disease in Britain. China had to cull millions of chickens to save the uninfected chickens. Britain had to cull millions of cows to save the remaining herds. Therefore, China shot dead about 250,000 of its citizens who had contracted the disease or were thought to have come in contact with the virus. Then China found a way to deal with the disease by strictly enforcing rules and ending the pandemic in China. But it incensed the Chinese that it had to murder so many of its citizens, and especially when I publicized this fact that they had murdered so many people. So they wanted to vent their rage on someone. They wanted to kill many of the original intended targets, which is the Punjabis and Sikhs in India. They prevailed upon the Indian alliance partner Narendra Modi, Prime Minister of India, to let many in North India die of the disease. As explained in my videos, Modi obliged by simply taking actions that would cause more deaths rather than prevent them. Remember cause and effect. There is a logical explanation for most of what happens. There is a cause for every effect. There is also a cause for why, after India, the United States leads the world in the number of deaths due to the pandemic. And the cause is nearly always people in high positions sabotaging the system. That is definitely true of the United States. People in the highest positions in the previous US administration, central government, set a horrible example, including personal examples on how to fight the disease. They confused the people and took or promoted actions such as mass gatherings without masks that would become mass spreader events. That's why one of the most scientifically advanced nations in the world had the greatest number of deaths from COVID 19. After nearly 18 months of the pandemic, there is enough scientific data available on how best to deal with the disease. This is what the data show. First, we we know that COVID 19 vaccines do work, and the United States has the best three available in the world. They are effective at preventing infection, serious illness, and death. Most people who are now getting COVID 19 and are filling up hospitals and their ICU units are unvaccinated. The risk of infection, hospitalization, and death are all much lower in vaccinated compared to unvaccinated people. Therefore, everyone aged 12 years and older should get vaccinated to protect themselves from severe disease and death. Secondly, since vaccines are not 100% effective in preventing infection, some people who are fully vaccinated, meaning they have received 2 doses of the Pfizer or Moderna vaccines and 1 dose of the Johnson & Johnson vaccine, will still get breakthrough infections of COVID 19. But even in cases of breakthrough infections, hospitalization and death are all much lower in vaccinated compared to unvaccinated people. Fully vaccinated people with a breakthrough infection are less likely to develop serious illness than those who are unvaccinated and get COVID 19. Even when fully vaccinated, people develop symptoms which tend to be less severe than in unvaccinated people. This means they are much less likely to be hospitalized or die than people who are not vaccinated. Therefore, everyone aged 12 years and older should get vaccinated to protect themselves from severe disease and death. Thirdly, methods for preventing spread of the disease are generally well known now. Virtually all nations that have been able to control the disease follow them. Common prevention tips include covering mouth and nose with a face mask, particularly indoors in public places, then social distancing or staying at least 6 feet apart from others, and frequently washing hands and disinfecting frequently touched surfaces at home. Cover your coughs and sneezes and don't touch your eyes, nose, or mouth. But it seems some governors, particularly Republican governors, have tried to impede the fight against COVID 19 by fighting mandates tooth and nail, even legislating that no mandates be imposed in their states. This applies particularly to the states of Texas and Florida, the second and third largest states in the United States by population. This means that there can be no mandates requiring vaccinations or wearing of masks in public places. They have put teeth into their legislation by withholding funding from local governments that impose any mandates. For example, a big battle has been going on in my home state of Florida, where the governor has banned mandates in any public places. That means even school districts cannot require mandatory wearing of masks by teachers and school children. Those school districts that impose mandates will have state funds withheld, which are a significant part of their budgets. The state of Texas has a similar ban on mandates. So, what has been the result? Florida and Texas now lead the nation in the number of new cases and hospitalizations. Among the big four states of California, Texas, Florida, and New York, Florida and Texas rank highest in the rate due to death rate due to COVID. Florida now has the highest ever number of cases, hospitalizations, and deaths, even higher than at the height of the pandemic a year ago. There is no escaping the link between high COVID rates, to the policies that are contrary to measures that prevent the spread of the disease. Dr. Jamila Taylor, Director of Healthcare Reform and a senior fellow at the Century Foundation, told Healthline that the state of Florida has lacked sound leadership when it comes to controlling the spread of COVID 19. The failure to follow the science, implement mask mandates, and protect Florida residents with clear pathways to accessing the vaccine have all been disheartening and to watch play out. The fact that there continues to be record new cases and hospitalizations is not surprising. Rational people agree that wearing masks is not only about protecting yourself from the virus, but also about protecting your neighbor. Why should a minority be allowed to put the majority at risk, particularly children? We accept leaders elected by a simple majority and allow them to make decisions for the entire population. Why should decisions regarding COVID-19 pandemic be any different? Once a decision is made and reasonably well explained, we should all get behind it. But people with a diabolical agenda oppose reasonable, rational decisions to harm as many people as they can. In my video of August 17, 2021, titled Governor Andrew Cuomo and the Italian American Delusion that they are irresistible to women, I discussed Governor Andrew Cuomo of New York on fighting COVID 19. I stated, the Attorney General's report that found that Cuomo had sexually harassed 11 women also concluded that the administration understated the true death toll in nursing homes by at least 4,200 and that deaths increased due to a state order that forced nursing homes to accept recovering COVID 19 patients. Families of the more than 15,000 New Yorkers who died in nursing homes say they want accountability. In the early investigations, for months the Cuomo administration did not provide documents and other requested data and allegedly may have provided false information to the Justice Department, which is a federal crime. Thus, as it turns out, Governor Cuomo did not do a very good job in fighting COVID 19 in his state, and he may have felt honored to lead, but apparently he did not lead well as far as the pandemic is concerned. I think the families of those whose loved ones died in nursing homes need a fuller explanation of what really happened. Thus appears that Governor Cuomo was responsible for the poor response to the pandemic in the early stages, as governors of Florida and Texas are responsible for the horror that is now taking place in their states with COVID 19. In Florida, some of the largest school districts defied the governor's ban on mask mandates and passed their own mandates and filed a lawsuit. A judge decided that the governor does not have the authority to ban mask mandates, but the governor has vowed to appeal the judge's decision. The case concerning COVID 19 in California, the largest state in the United States by population, is different. Governor Newsom of California is facing a recall election. The reasons for the recall, according to supporters of the recall, are that he mishandled the state's response to the coronavirus pandemic, did not do enough to address the state's homelessness rate, and address sanctuary city policies and water rationing. The coronavirus policies that the voters in California did not like were his mask mandates and closing down parts of the economy, such as temperatures, schools, and other establishments. Closing down parts of the economy, such as restaurants, schools, and other establishments in the early stages of the pandemic. Governor Newsom was taking the right steps to control the pandemic. He was right when he called the effort a Republican recall, backed by the Republican National Committee. Anti-mask and anti-vax extremists and pro-Trump forces who want to overturn the last election and are opposed much of what we have done to fight the pandemic. Thus, in the largest state where a governor was taking the right steps to fight the pandemic, he is being recalled precisely for taking those steps. This obviously indicates a large population in California that is actually interested in hurting Americans and opposes those who try to do things right. In the other three states, the governors are taking or took steps that actually led to deaths of more people from the pandemic than was necessary. When we look at the deaths of the 10 gurus of the Sikhs and the actions of leaders in some cases and the population in other cases regarding the pandemic, words that Isaiah the prophet spoke to in prophecy about the conditions in America and British Commonwealth nations in our time come to mind, which are written in Isaiah 1 verses 5 to 6. The whole head is sick and the whole heart faint. From the sole of the foot even to the head there is no soundness in it, but wounds and bruises and putrefying sores, they have not been closed, neither bound up, neither mollified with ointment. We know there's one easy solution to the gun violence: ban guns. Similarly, to effectively control the pandemic, take steps that many other developed nations have taken, such as preventive measures and vaccinations. But many leaders are taking actions that are actually leading to spread of the disease again in a new wave. Seeing all this taking place, we should come to the conclusion that in America the whole head is sick and the whole heart faint. From the sole of the foot even unto the head there is no soundness in it, but wounds and bruises and putrefying sores, unless there is more to the story. Yes, there is actually more to the story than is visible on the surface. The reason legislating banning of guns is not a good idea is that German masqueraders, who are people of German descent living in other countries, will simply not obey the law and clandestinely will own guns. When they make a bid to take over the country, it'll then be easy for them to use their guns and kill many non masquerader white Americans and those who are not allied with them. That's why we cannot ban guns. So there is a logical explanation why guns are not being banned, even though guns are leading to more violence and deaths than would be possible otherwise. In the same way, there is a logical explanation for why some leaders and their followers are taking actions that exacerbate the pandemic rather than stopping it. The reason is that these people are either German masqueraders or are allied with them. Their goal is to allow as many Americans as possible to die. This evidence leads us to the distressing conclusion that the actions of some of our leaders and their followers are deliberate and diabolical, designed to kill people so that they can take over the country for themselves quite easily. Thank you very much for watching this video. Please continue to watch my videos and read my articles on important world events, World War III watch, politics, international business, advice on health and medical problems, and much more for in-depth and insightful analysis. Please also subscribe to my YouTube and Facebook channels, Unmaxed Truth with Harmanjeet Saini, to view and get information on the latest videos. You can also find the text of my videos on my Facebook channel.